Welcome to Help by Numbers. I'm KB. No scrubs, just facts. We diagnose myths, prescribe stats, and explain medicine without the drama. Let's get into it. Bell's palsy. Think of it like it's when the facial nerve wakes up and decides, you know what, I'm taking the day off. Now, what is the facial nerve? It's basically the US cable to your face. It runs from the brain to the face and controls everything about your face: your smile, your blink, your eyebrow raise, all the small expressions that make you look alive. So, when the nerve gets irritated or squeezed, the messages don't reach the muscles, and suddenly half of your face is like, Boss, I didn't get the memo. But worry not, we'll break this down simply, very clearly, and without medical drama. Because on this channel, even facial paralysis gets explained calmly. So, what exactly is Bell's palsy? In simple terms, it's when one side of your face suddenly stops working the way it should. It's not because the muscles are tired, but it's because the nerve that controls those muscles has gone quiet for a bit. Think of it like a phone with poor reception. The message is trying to get through, it's just not reaching the other side clearly. And that's really the core of it. It's not a stroke, it's not a permanent shutdown, it's just a nerve that needs time to reset. So, what does Bell's palsy happen in the first place? Well, the truth is, sometimes the facial nerves get irritated, usually by inflammation. Most of the time, the inflammation is triggered by a virus, not the kind that causes chaos, just the quiet, common ones that live in all of us. When the nerve swells, it runs out of space inside the tiny bony tunnel it sits in, and suddenly the signals to your face don't travel as smoothly. It's less of a dramatic attack and more like a traffic jam on a narrow road. Nothing's broken, just slowed down. So, how does Bell's palsy actually show up? Usually, it's sudden. One side of the face stops moving the way it should, the smile becomes uneven, and the eyelid on that side just won't close properly. You might also notice drooling, speech feeling a little off, or food collecting on one side of the mouth. Not because you've forgotten how to chew, but because the muscles simply aren't getting clear instructions. And here is the key detail. If the forehead is also affected, that droop, that flattening of the wrinkles, you're usually looking at Bell's palsy. But if the forehead is completely fine and only the lower face is drooping, that's when we think of a stroke, and that needs urgent attention. So, here's something that really matters. Because Bell's palsy can look a lot like a stroke at first glance. With Bell's palsy, the entire side of the face is involved: the forehead, the eyelid, and the mouth. But with a stroke, the pattern is different. The forehead usually still works. You can raise the eyebrow, you can wrinkle the forehead, and the lower face droops. So, if the forehead still moves and only the mouth is sagging, that's when you get checked immediately. But if the whole side is weak, top to bottom, it's far more likely Bell's palsy. It's not a medical emergency. So, what does recovery really look like? I plotted real recovery data here using Tableau. That's a tool that takes raw clinical information and turns it into something we can actually see. And what it shows is simple. Some patients sprint in the first 3 months, others take the scenic route, but by 9 months, they all converge at the same place: normal function. This isn't guesswork, it's recovery you can visualize. Bell's palsy starts out loud, but the trajectory is steady, predictable, and in most cases, complete. So here, I went one layer deeper. This isn't just the recovery timeline, it's the shape of the symptoms themselves over time. I analyzed this using Python inside Jupyter Notebook. That's where the data gets cleaned, organized, and told to cooperate before it ever becomes a visual. And the pattern here is clear. At the beginning, the symptoms peak: high, abrupt, and comfortable. But by the 3 month mark, they drop sharply and then continue tapering off, slowly but steadily, into normal function. No guessing, no vague reassurance, just the data laid out plainly, showing the Bell's palsy has a loud start, but quite finished. So, here's a big picture with Bell's palsy. It looks dramatic in the beginning because the face changes suddenly and without warning. But the story after that is quieter. Symptoms improve steadily, not instantly, and in most people, they resolve completely. The key is simple: know the symptoms early and know the red flags. Because once you understand what's normal and what needs urgent attention, the fear starts to dissolve. Bell's palsy isn't a life sentence, it's a detour, one the body usually corrects on its own. That's it for today. If this helped bring clarity, a like, a comment, or a subscribe goes a long way. No scrubs, just facts. I'm KB, and this is Health by Numbers. See you in the next one.